Hi, Simon Smart, GI.healthcare. I'm going to talk today a little bit about psychological therapies in irritable bowel syndrome. So I've covered in previous videos strategies for managing diet and lifestyle, including exercise and sleep and stress. But this video is more aimed at those who might benefit from specific psychological therapies. So, quoting from the NICE guidance here, referral for psychological intervention, which may be cognitive behavior therapy, hypnotherapy, or psychological therapy, and many different modalities of psychological therapy have been shown to be a benefit, should be considered for those with irritable bowel syndrome who do not respond to lifestyle and pharmacological treatment. You might ask whether that would be different advice if psychological therapy was more widely available, because certainly within the UK, accessing psychological therapy can be difficult. So a wide variety of psychological therapy has been shown to be a benefit in irritable bowel syndrome. And in terms of the number of people you need to treat to get improvement or symptomatic relief, it's roughly 1 in 4, which is very similar to the number you need to treat for any of the drugs you might choose to use in irritable bowel syndrome. So it's at least as effective as drugs, and some might argue that it's less likely to cause side effects. I think you can argue that, actually. It may be help with symptom management, or, and by that I mean if people are suffering from urgency and diarrhea, it might help them to manage that urgency and diarrhea, or it might help address some of the factors in their lives which are causing symptoms. So I think if people have either traumatic previous life experiences or particular stresses within their work, for instance, being a pilot, then that can help. Psychological therapy can help address those particular issues. So I would observe that psychological therapies are generally under-resourced, and finding the appropriate professional, as with all healthcare, can be challenging. But the other thing is, just because you've seen someone in the past doesn't mean that someone else couldn't help, because psychological therapies are very dependent upon individual relationship. So next I'm going to talk about drug treatment for irritable bowel, and I'll do that in a different video. Thanks very much for listening.